Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, and I'm a communications specialist with the Division of Public Health and Community Services. And I'm joined today by our epidemiologist, Angela Consentino. Welcome, Angela.
Hi, Jane. Thanks for having me.
Thanks for agreeing to come again, Angela. I think you'll be coming on pretty frequently till we get out of this mess that we're in.
Yes.
But we really appreciate you being here, trekking out in this cold weather, in the slushy snow.
Yes.
But it is, it is kind of our obligation right now to keep people up to date on the numbers. And we like having you here because you can explain what those numbers mean.
Yeah.
So if you don't mind, you could kick us off with a COVID update.
Of course.
And let us know what's going on worldwide right now. And
Sure.
we'll get smaller and smaller, I guess.
Yeah. So, case activity continues to be heightened across the globe and the nation. So as of today, we're at 75.2 million cases worldwide, with 1.75 million deaths worldwide. In the U.S., we're at 17.2 million cases and 311,000 U.S. deaths.
Wow. So we've really, and as I say often on the show, I put in these numbers week to week, and I am just shocked by, a 10% climb really in the number of cases
Yeah.
in our country. So it's everywhere right now. So that's
Yeah.
something to keep in mind. So tell us a little bit about what's going on in New Hampshire as a state.
Yes. So New Hampshire is experiencing substantial community-based transmission in every county in New Hampshire right now. So we're looking at 33,433 cumulative cases, which means all the cases that we've had throughout the course of the pandemic. And then we have 6,680 active cases.
Wow.
So that means cases right now that are currently shedding virus and within their active incubation period.
Which is a large number. It's about 20% of the total cases in the state to date. So right now, in this short time frame, we're experiencing a large chunk of the positivity, so to speak.
Yeah, and so that kind of gives us an indication that, we're going to continue to see this number increase because the more people that are out there infectious, shedding virus, the more people that are going to get sick. So until we see that number drop down, we're going to know that new cases are coming quickly. And so we also use the percent positivity rate to determine transmission. So for the state of New Hampshire, they're at 8.8% with a percent positivity rate. This is taken over 7 days for both PCR and antigen tests. And what it is it's just the total number of PCR and antigen tests over the number of positive tests, or vice versa, actually. So that tells us, of the people who are seeking testing, how many people are coming back positive. So it gives us a kind of a general idea of the whole community at large who's coming back positive for COVID-19. So if the percent positivity rate is 8.8%, we can say, well, about 8.8% of the population is currently COVID positive. And we can say that because we have robust testing systems in place. We offer community-wide testing, and it's not just high acuity infectious individuals that are getting tested.
So we're really seeing, because we have so much data now, because we've tested so many people, we can transfer this number really with a different meaning.
Yeah, to the community at large. 7,624 people are tested each day.
Wow.
It's a huge number.
Yeah, that is a huge number.
Yeah.
I thought we tested a lot in our one clinic. We're just a little drop in the bucket.
Yeah.
And we see too that we've had 625 deaths in the state.
Yeah.
Unfortunately, we're seeing an announcement of deaths pretty much every day right now since we've had this new surge.
Yeah. So we do know, older people are being impacted in the long-term care facilities and at home, and they're the ones at highest risk of, death. So we've had a few deaths in Nashua in the past week, and it's a sad thing.
Yeah. It's really unfortunate. And our sympathies really go out to those families because this is just, even though we've been in this pandemic, it's still losing a loved one is so difficult during this time. So why don't we take a look at our map? I actually looked at this map last week with Bobby, and pretty startling, as you said already, that we have substantial transmission in the state of New Hampshire. So that's why that map on the right is completely red.
Yeah.
No room for error there. And then the map on the left, we're showing that the darkest spots are the places with the highest transmission rates right now.
Yes.
And if you notice that little dollop at the bottom,
that's us.
That's us. That's Nashua.
Yeah.
But it's pretty startling because you do see it. It just really sticks out like that. And you're like, what's that?
Yeah.
Manchester's on there. Also, they're kind of just lumped in with that other strip. So tell us a little bit more about what's going on in Nashua.
Yeah, so these two maps right here, they show us our community-based transmission. And community-based transmission is determined by 3 indicators. The first indicator is new cases per day, or new cases per 100,000 over 14 days. That is this one with the different shades on the left. And so in Nashua, we're at about 950 new cases per 100,000 over the past 14 days. For reference, back in September, we were less than 100. So that number has really skyrocketed over the past 3 months. And we've been substantial in that category for about 2, maybe 3 months now. So pushing past 100 is what pushed us into the red category for that. And we've been in the red. I know, Jane, it was you. Is there anything higher than red that asked that question? And no, we're just red.
Yeah, like what shade should I use, Angela? Like bright red, dark red, red? Yeah.
But unfortunately, we're just red.
Yeah. And I get assigned to the graphics, and there's just like different colors. You got to pick different ones.
And so that's just one piece. And then the second piece is the new hospitalizations per 100,000 over the past 14 days. And so our hospitalizations are also on the rise. So last week we were at 2.2 new hospitalizations per 100,000 over the past 14 days. 2 days ago we were at 5.6. Today we're at 9. So we are seeing an increase in hospitalizations, which means an increase in severeness of illness for people because they're feeling so sick that they need to seek out services at the hospital. And we meet with the hospitals every week, and we talk to them about, how are you doing? What support do you need? And so they are able to manage this surge internally at this time. But they are seeing an increase in people going to the hospitals for COVID.
Right. And I think what people need to understand, the stress on the hospital, not only is it a greater amount of sick patients, but you can't expect the staff to remain completely healthy either. And so the staffing capacities get very strained because they get COVID too.
Yeah.
So those are the things that people don't realize, is that, one of the reasons that hospitals get strained as well is because there's that pressure on their staff as well, and there's absenteeism and that kind of thing. Right now, like you said, we meet with them every week, twice a week now, just to make sure there are no need for PPE and those kind of things. And we keep a close eye on that as a public health department and as really a community partnership, working together to figure out how we can help one another get through this surge. Yeah,
and one thing that we can do as a community to help our hospitals is not to go to the emergency room for testing. So if you have cold, flu-like symptoms and you think you may have been exposed to COVID-19, you can call us at our hotline number. It's 589-3456 to schedule a test on Tuesday afternoons. Or you can call an urgent care center or your primary care provider to get tested for COVID-19.
Right, but stay out of the emergency rooms because that really puts another strain on the hospitals, and we really want people to use them appropriately. And there are plenty of pharmacies that are doing these, Convenient MD, different places around the city where you can also get a test. So
and I just want to mention the difference between the PCR and the antigen test. So the PCR is the nasal swab that comes back in 48 to 72 hours, and that is anyone can get that test. If you've been exposed, you haven't been exposed, you have symptoms, you don't have symptoms, anyone can get the PCR test, and it will tell them right now if they have active COVID-19 virus in their body. The antigen test is a little bit different because you have to be symptomatic, and it also comes back quicker. So if you've
And
had
a lot
symptoms,
of people, I'm just going to interrupt because a lot of people call this a rapid test. We take phone calls all day. I want a rapid test because they think that'll put them at ease. But there are some conditions around which we use these. So.
Yeah. And the rapid test is only appropriate for people who are symptomatic. So I just wanted to make that distinction because there is a lot of confusion about it.
Right.
Yeah.
So if you've been exposed to COVID-19, it's been 5 days and you're starting to have cold and fever or those kind of things, you would be an appropriate candidate for an antigen test or a rapid test.
Yes.
Otherwise, your best route, if you've been exposed and you do not have symptoms, you just need the PCR test.
Yeah, exactly.
So, yeah, and a lot of people do call with those questions. And
Yeah.
so that's a great thing to bring up for us. So this next graph, Angela, you want to walk us through that? I mean, it just basically boldly tells us that we're on the rise.
Yeah, so this is the case counts by week in Nashua over the course of the pandemic. So you can see our spring surge there, which is it's funny now, that we think of that as a surge, but that was our spring surge. And now we're in November, December, and we're almost triple what we were, if not quadruple what we were in the spring. And these are case counts by week. So our cases are way up than they were in the spring. We had 61 cases per day on average last week.
Yes.
And so that's a lot of new cases per day.
That is a lot. It has made our office incredibly busy.
Yes, it has.
Trying to reach out to those folks and make sure they're taking the proper precautions, staying home, letting their family members know, letting people know that they may have seen the prior 2 days before they got sick. So we're really, that's a huge amount of cases. And as you said, and what I find really interesting about this graph is that when we were in the height, say April, May, June, like you said, the spring surge, we were all home.
Yeah.
People were really staying home. And we're not anymore. And it is impactful. And so if you can't see that from this, this is proof. We're out and about. We're doing our shopping. We're doing our, we're eating out. We're doing those things. And it is having an impact on our community.
Yeah, and we can just see that just by the number of cases alone.
Yeah.
Yeah.
So let's visit this percent positivity thing. You talked about it a little bit with the state. Again, our rate in Nashua, as you said, can apply to the community as a whole now, is higher than the state's.
Yeah. So we look at this, we see 11% positivity rate. So that means about 11% of people who are tested for COVID-19 are positive for COVID-19. So if we generalize that to the total population, that means when you're in the grocery store, or you're at the mall, or you're in a restaurant, you can assume that 11% of those people in that place have COVID-19.
Wow.
So it's a large number.
It's a large, yeah.
If you're in a group of 100 people, 11 of those people are currently infectious with COVID-19. So that's why it's so important that people who are getting tested, or people who have been exposed or at risk, or who have symptoms, stay home.
Right.
Because then that reduces that load on other people.
That transmission.
Yeah.
Right. Don't try to sneak in one more thing, especially if you have symptoms. If you have symptoms and you've gone and made the effort to take the test, wait until you get the results before you give yourself a free pass. Because, it's just, I guess when you're saying that one out of every 10, I'm picturing doing my grocery shopping and, it's always crowded. I always go on the weekend and we're getting closer to the holidays. So, and kids are home doing remote schooling, college kids are home. My grocery bill is continuous. I think I'm in the grocery store every other day just to pick up different things. But all of a sudden I have this picture of oh my gosh, in my aisle, at least two of us are, two people have the virus. Yeah,
and so that's so relevant right now because our number of people who have no identified risk of cases is really high. We're at 54% of cases in New Hampshire have no identified exposure risk. So that means that when we ask them, so how do you think you've been exposed? They haven't had any family member that's been sick. They haven't had any friends that has been sick. They have no workplace related exposure. They haven't traveled anywhere recently. The only thing that they've done is say, go to Market Basket or go to the pharmacy or walk their dog. They have only been doing general things out in the community. And so they have no identified risk. We can't trace back their exposure to a specific moment in time. So that is a huge factor right now in New Hampshire with the number of new cases per day that we're seeing.
Right. So, I mean, it just bears repeating, you know, you can do your errands, but, you know, you are safest at home right now.
Yeah.
And, you know, we're tired as, you know, we have COVID fatigue, but we just kind of have to keep it up and maybe consolidate your errands and not spend a lot of time in a store where there are a lot of people.
Yeah.
You know, just kind of shuttle in and shuttle out. And I do that, even though I am a little guilty of having more than one trip to the grocery store a week. I do try to get in and out and just, you know, and I do see sometimes most people are really good about, you know, having those masks on.
Yeah.
And so that's great. But then there are people that think it's okay to wear it around their chin, and that's just not okay. You're not protecting yourself. You're not protecting the people around you. So we just ask people to keep wearing your masks, keep that 6 feet or more apart from people in those shopping experiences. Holidays are coming. People are going to want to go to the mall. But, you know, it's out there, folks. So there is risk.
Yeah.
You know, that everything that you do right now comes with a little bit of risk.
Yeah. And I know personally, I've walked into a grocery store and it's been packed, and I've said to myself, if I'm going to get COVID, it's going to be in this grocery store. I need to not go to this grocery store right now. I'll go tomorrow morning or something. So if I see a situation and I'm nervous about it, I just leave, you know, just because
it can wait.
Yeah.
You can open that can of beans, right?
Yeah.
We like to share recipes, Angela and I on the side. So just let's talk a little bit about defining exposure to COVID-19. Because again, we get a lot of calls in our office. People get a little confused. Well, a friend of a friend did you know, when does someone have to really think they were exposed?
So if you've been within 6 feet of someone for 10 minutes or more with or without your mask, and that person turns up positive for COVID-19 within 2 days of you seeing them, you are considered a close contact to that individual, and you should monitor yourself for signs of symptoms, and you should get tested. So, for example,
stay home, right? Begin a quarantine.
Yeah. So, say for example, tomorrow, Jane, you were to go get tested, and you tested positive. You and I have been sitting 5.5 feet apart with masks for about 20 minutes. So I would be considered a close contact to you. So I would need to stay home. I would need to monitor myself for flu-like symptoms. And I would probably get tested in 5 to 7 days from now. So those are the kind of exposures that we're looking for. Or exposures where you were in a facility that had an outbreak of COVID-19. So say you were at a bar or a restaurant and you hear on the news that bar or restaurant had an outbreak and actively ill individuals were there when you were there. Then you would go ahead and get tested just to make sure that you were not impacted by the outbreak.
Yeah, so there's, you know, it's important for people to think about where you've been, how close you've been to that individual who tested positive, how much time you spent with them. Did you wear a mask? Did you not wear a mask? Proximity is really important. You know, you really, if you're gonna see friends, you know, you got to stay apart.
Yeah, and the activity is also pretty important. So if you're like in a choir with somebody who tests positive for COVID-19.
Yeah, we've ended all choirs now.
Yeah.
If we haven't done that by now, we're in trouble.
Yeah, or you're in a band.
Okay.
Or
that too, Angela.
Some other spewing activity.
Right.
Then you might be at higher risk.
Yeah, so we just want people to be careful and understand what that exposure means, because there's two sides to this. There's people that just brush it off, and then there's the people that panic, and we want to get somewhere in between where we think about how long have you been with them, at what time. They may not have been infectious at that point, so you know, we just talk to people about that, and also, we want to remind people that are COVID positive that they need to be in touch with the people that they saw 2 days before they got sick.
Yeah, that's hugely important because we have a massive number of cases at the health department. So it's really important to put the onus and the responsibility on the individual who tests positive. So if you're a person who's tested positive, you cannot rely on the health department to call everybody that you've been in contact with to talk to them about their exposure.
Which we used to do.
Yeah, so we used to do
can't.
it, and now there's too many cases. We unfortunately cannot do that anymore. So it's up to the individual to make those calls and talk to those people and let them know, hey, I tested positive. I saw you the day before I tested and I had a cold. You should probably get tested and keep an eye out for symptoms and stay home. And so it's also important to notify your workplace. If you were at work and you were sick and you tested positive for COVID-19, it's essential that you notify your workplace or your school of that exposure.
Or your daycare,
or
if your child has tested positive.
Yeah.
So all of these things, and like you said, we're actually having, because there are so many cases, we have to put that responsibility on the community. And my mask is slipping, excuse me. We have to put that responsibility on people because in the good old days, we could call people, we could get all their contacts, we could figure it out, and then we could call those contacts. We can't do that anymore.
Yeah.
We're just at our capacity. And so this is an effort. If we want to stop this in its tracks, we have to all take a part of that.
Yeah.
So let's talk a little bit about we're coming up on the holidays. So we want to talk a little bit about holiday travel. We don't recommend holiday travel. If you can stay local, it's better. If you can celebrate in your own home, we would appreciate that. If you are going to have gatherings, keep them small, keep them spaced, keep a window open.
Yeah.
I'd like to say do them outside, but really that's not really realistic given the state of our weather and our slushy ground.
Yeah.
Consider a virtual celebration. And, I know it's not the same, but we've had some good laughs online with my family, and we're able to do that on Zoom or on Facebook Messenger has a good platform also. And then if you do travel outside of New Hampshire, we ask you to quarantine for 10 days when you come back.
Yeah, and it's important to keep in mind too, if you're deciding to travel and you're deciding to go to South Dakota to visit Uncle Jerry for the holiday, keep in mind that many states have a quarantine requirement in place already. So if you are going to a different state, well, first off, you have to get on an airplane, and the airplane probably requires a negative test to fly. So you have to get tested within a certain amount of time, get on the plane, sit on the airplane, get to your destination, and then you have to quarantine most likely for a certain period of time while in that state. So that means that you're not supposed to see any residents that live in that state until 10 days have passed. So if you want to see your relative on Christmas,
you should have left already.
Exactly. And then when you get back to New Hampshire, you have to quarantine for another 10 days.
Right.
And yes, you can test out of travel quarantine, but you have to test on day 7, and it has to be a PCR test, which takes 48 to 72 hours to return. Right. So you're going to be in quarantine for 10 days regardless, because you have
and
to
I can attest to that because I had to do some travel about a month ago, and I came back and I said, oh, great, I can get my test, at the division. And it still took, 10 I was basically in quarantine for 10 days working from home.
Yeah.
And we have this U.S. map that we show, and we can see, all these states are very dark and not doing so well. So there aren't that many safe places to travel right now where there isn't, a lot of community spread, so Vermont, I guess, but they don't really want us to travel there right now.
Yeah. A good rule of thumb is don't go to a state that's darker than New Hampshire.
Yeah.
And if you are going to a state that's lighter than New Hampshire, remember that you're posing those residents a risk.
Right.
Yeah.
So our final graphics, again, a testing a lot of people say, I want to get a test so that I can travel. And what we want to say is just because you test negative, there was no virus detected in my system today, it doesn't mean in 2 days or in 5 days, if I get exposed between then, and I've already left on my trip, that I'm putting other people at risk. So I mean, the safest thing in my mind is that you should have already left and quarantined in the other state, or, stayed home for 10 days and then maybe took your car trip.
Yeah.
Because really there's just there's no guarantee that you're not going to be spreading this.
Yeah. So, for example, like this on this graphic, if you're exposed to COVID-19 on December 19th, and then you say, oh, I'm going to get tested so I can see my family on the holidays. You get tested, you get a negative test results 5 days after December 19th, which is December 20th, you start to develop symptoms, and or December 25th, and then you can start spreading virus to your family on Christmas or Christmas Eve, regardless of your negative test result.
Even if you get tested after Christmas, you are contagious during Christmas.
Yes.
So we just ask people to really think about this stuff. It's real, it's out there. On a more positive note, Angela, I've been told that we're a little bit downerish sometimes on the show, but but we don't always have the best news to deliver. But the vaccine has arrived in New Hampshire.
Yes.
It's not a panacea. It's not going to solve all our problems. The rollout is slow. We are getting about 12,000 doses from Pfizer to begin with, so that's great news. It is a tiered distribution. So right now we're really looking at the at-risk healthcare workers first, and then we'll go to the older adults in residential care settings, and finally to the first responders. Those are like our ambulance workers and our EMTs, law enforcement, and COVID-19 responders. So you can see that tier. It's coming. It's hopeful. Keep your mask on, though, because you have to have 2 doses. And you have to have those doses 21 days apart, I believe. And so we just want people to know, yes, there is a glimmer of light at the end of this tunnel, but we're not there yet.
Yes.
So exciting times, though, and kind of a relief for a lot of us who have been working in this.
Yeah.
So thank you, Angela, for joining us. I really appreciate the information you're sharing with us and the explanations you've been giving us all along. I'm sure we'll see you again after the new year. And I want to remind people that if you do need a COVID test, we are offering them through the Division of Public Health. Our location has changed. We are now going to be at the National Guard Armory on 154 Daniel Webster Highway. There is limited bus access if you need public transportation. The number to call if you want to make an appointment is 589-3456, or you can go online to our website and make an appointment through a registration form there. We'll be back with our next guest, Dr. Marie Ramas, family physician from Nashua. Welcome back to Public Health Matters, where we talk about matters in public health. I'm now joined by Dr. Marie Ramas, a family physician in Nashua. Welcome, Dr. Ramas.
Thank you so much.
Thank you so much for being here and talking to us about your experience during the last 9 months, really. Being a doctor in Nashua during a pandemic.
Definitely.
Pretty challenging times for you and for all of us. So first of all, I thank you for taking time out of your probably very busy schedule as a family physician. So tell me where you were in March and what you were doing when the pandemic started really affecting us here in New Hampshire.
Yeah, so I've spent the bulk of my career working within the community health center settings. And so at the time I was working with a community health center, taking care of, a lot of I call them our invisible essential workers, housekeepers and cleaning staff and nursing assistants. So definitely there was a concern as far as their risk for exposure And then, of course, with the novelty of the virus, there was so much new information coming in at once. The question of trying to get information that was relevant in an effective way to our community so that people can understand and make educated decisions was of utmost importance.
And so when you're at that community center, was there a language barrier with any of the folks that you were treating or meeting with? Or
That's a great question. So I speak a lot of different languages, and so the bulk of my patients do speak other languages as well. So part of the difficulty was, while information was getting transmitted and communicated, how can my patients really get the information in a way that they could understand? The other concern was our notion of household was difficult. Different cultures can interpret household differently. Family can be very extensive in different countries, and a family, the word family can extend outside of the walls of our home. And so being very deliberate and intentional about communicating, level of exposure, why it's important to be safe, the concept of using a mask and keeping physically distant for some cultures is very difficult because in daily interactions, people just live in closer proximities.
Right. Some of the housing is shared, and we see that a lot when we do our testing clinics, and we see families, and there'll be 5-6 people coming, in one car to get tested, and they all live together, and they live in a smaller apartment, and you have to be really attuned to that. It's affecting a lot more people when you're in those kind of living conditions.
Exactly, and the ability to adequately protect yourself when you do get sick. So, I think that the state did a great job, and the city of Nashua particularly did a great job of, adapting and being more accessible when it comes to culturally appropriate messaging. And I think that was very helpful. It's always helpful to just know that you belong and that there's a place that you can go to. And being a family doctor, I'm a little biased about that, making sure that everyone has a medical home for that reason.
Right. And so you said you speak a lot of different languages. So we backed up, we missed the most important question. Like, you're a New Hampshire native. Well, you grew up here.
I did.
And you went to high school in New Hampshire?
Yes, I was born in Boston, but I was raised in Manchester, New Hampshire. And I graduated from West High School in Manchester. And after going to undergrad and graduate school, getting married and having kids, decided that we wanted to come back home. So 4 years ago, my husband and I decided to come back to New Hampshire and set our roots and start to make a life and foundation and to reconnect with our families again.
Yeah, well, I'm sure the grandparents are very happy.
Definitely, definitely. It's a busy home.
Yeah, so I'm sure that they're thrilled, and we're thrilled that you decided to come back, because we really can use this kind of culturally competent and aware kind of care in our community. It's just so important. So COVID came, it was very stressful. And you made a switch. Can you tell us a little bit about that?
Yeah, one of the things that I think COVID highlighted was the gaps within our health delivery system. And to every wheel, there are many pegs. And one of the difficulties, particularly with COVID, is the immense amount of stress that our healthcare workers, our physicians, our nurses, and those in the staff that support the main clinical teams face. And that's definitely was true for me and for many other primary care docs within the state. Many of us were facing challenges of protection, having enough personal protective equipment like surgical masks, questioning whether we should expose ourselves to the risk of this novel virus and potentially exposing our family.
Absolutely.
There was questions of economic, uncertainty. And I experienced that too. there were many nights that I lost sleep, not only on behalf of my patients, but also for my well-being and for that of my families. And so after helping the immediate community within the health center, we did some great things. We were able to secure hundreds and thousands of PPE through donations and through extensive networks within my national connections with the American Academy of Family Physicians and family docs around the world, giving up-to-date, real-time, experience on how to manage COVID, what were the signs and symptoms. So I'm really proud of how our medical community in my clinic, dealt with that. But the other thing that COVID showed for me was that I needed to take some time to make sure that I was available for my own family. And so after about a decade of doing, I call it Dr. Quinn medicine, being in the hospital, delivering babies, doing circumcisions, taking care of outpatient, and kind of doing all of that bread and butter, I call family medicine, I decided to take a step back and have another opportunity to serve a different community that also needs attention from a primary care perspective, but also allow some flexibility so that I can play the other roles of my life as a mother and as a wife.
And that balance between our work life and our home life is critical.
You're so right.
Because you can't be good to one or the other if you don't have that balance.
And that's what it's all about. I think if we can get any positivity from COVID and from this experience over almost a year, that people are really starting to prioritize what matters most. And what matters most is relationship. What matters most is people feeling that they are part of a community. And that can look different in different ways.
Absolutely. So where are you now?
Right now, I'm a medical director at Gatehouse Treatment Center, which is located in Nashua, New Hampshire. And I provide integrated primary care for the clients who stay within their transitional housing program. And so it's a really great model because we have our behavioral health group. We have the substance use, treatment side. But I'm there to look at my clients and the patients there as a whole person and to help them with their wellness journey. So often, in that game, that rat race, we call it, we forget about our wellness, our personal wellness. Without wellness, then, we can't work to the best of our capacity. And I think that's really important for the next few months as we're trying to revamp how we approach COVID.
Yeah, and so you're talking about a treatment center, and I've been doing. I see the articles in the paper also, whether or not what happened during COVID to those who have substance misuse disorders. Were there an increase in overdoses? Was there a decrease for a while? How did this population fare?
That's a great question. Anecdotally, I can definitely say, and the numbers support this, that it became much harder, that as services that are known to help maintain sobriety, as they became more and more limited, and then the isolation definitely triggered more use, more mental health upticks, I would say. And so we're at a place where we're a little bit more stable now that we have mechanisms in place for our patients that are struggling. But there is a concern, and that's a question that I pose to my clients, my patients as well. When you leave this very controlled and nurturing setting, what are your plans for doing life with COVID? And that's a very different look than before COVID.
Right. And even with COVID in a treatment facility, you have to take certain precautions. It's congregate living.
That's right.
So are there certain precautions they're taking there to keep the residents safe?
Definitely. We at the center, we do routine testing of all of our residents, and so once a week, everyone gets a PCR testing to make sure that there's no active infection occurring that may be asymptomatic. So because we live in they live in such a close proximity environment, it is considered more of a higher risk environment, almost like those long-term care facilities.
So you're doing the weekly testing and just making sure. And is there a lot of inflow and outflow of the facility? So that's another thing when you're bringing someone in from the outside, it's a whole nother.
Exactly. And so just like we do everywhere, masks have been shown to be the #1 prevention of infection. And so making sure that we're maintaining good hygiene, that we're using masks as much as we can help protect everybody, and that's the concept of community that I try to stress as well. You're right; it does complicate things since we have a lot of flux between the residents and many people coming in and out of the program. So that does add to the complexity. But when it comes down to the bottom line, washing hands, wearing your masks, and staying as physically distant as possible for people that are outside of your home are the main things that we can do right now to help everyone.
And we appreciate that plug, because I say this all the time on the show, and I'm happy to have a medical expert come on and just reinforce that, because that's just, those are the things we say till we're blue in the face. People get tired of hearing them, but they're just so critical for our daily health and maintaining it.
I'm really glad you said the fatigue aspect. All of us have been living this way for 9 months now, since March, and we're all tired. We're exhausted, to be honest, right? And it's not just physical exhaustion; it's exhaustion from being isolated. It's exhaustion of limited, exposure to people that we care about. We're emotionally tired, mentally drained. And so, part of the resilience that we need to show as a community, and something that I repeat to my patients and to my friends and family, is that every little bit, the simple things that we can do every day, can make a huge difference down the line. And that could be the difference between us getting out of this a month early. It could be the difference of us getting out of this, a few months early or later. It could be the difference of lives. And that's where we're at right now in the state. We're at, pretty much capacity, and we're beyond where we were when we started. So any little thing that we can do to help promote our wellness and to help the health of those around us immediately is going to make a huge difference.
Right, and it's not just about our health; it's about our community. And this is a pretty incredible community. So if we all do our part and take our personal responsibility for ourselves and for one another, we can really, like you said, let's drop it at its knees, as Bobby would always say. Just like, so one other thing that we talked about a little bit before we went on air was that your work with this Diversity, Equity, and Inclusion Committee in your school district. And we talk a lot about equity right now in healthcare, because in a pandemic, it is very clear that our most vulnerable are the most affected by this. People, Black and brown people, we have immigrants, we have all sorts of people, people with chronic health conditions. And they're more affected by this pandemic than anyone, and they have the least access to services.
Yeah.
So, but that being said, when we talk about equity and inclusion, tell me about that a little bit.
Right. So in right next door in Hollis and Brookline, our school district has decided to take a further look into diversity, equity, and inclusion, particularly during this time, because one of our lifelines as a family doctor is the school when it comes to health and wellness of our families. And foundational unit of any community is the family setting, however we define that. And so we recognize that in the community, equity is not just race. It's different experiences, different opportunities to create an environment where kids can be the best form of themselves. And that's really what equity is. It's not necessarily coming to the same endpoint, but getting to everyone's personal peaks. And so with COVID particularly, and with the remote learning setting, how do we address these gaps that our kids have, both from an emotional standpoint, a social standpoint, and an academic standpoint. And so I'm really happy of the progress that we've made as a committee of community members, giving input about what's important for us and for our families that the district can take a further look into, and then implement some strategic changes from a board level and from a school district level, bringing in the experts within education on that. So we are presenting a resolution, a document that I think reflects the voices of all members of our community on what really matters for our kids. And that is that our kids can have an environment where they all feel valued, respected, and can have difficult conversations in a way that is respectful and mindful of one another. Everyone wants that, and I think we're doing a great job modeling that for the rest of the state as well.
Yeah, I was thinking as you were saying that, I hope that the work you can do in your little town, which happens to also be my little town also, but I hope that work can be replicated and that you guys can serve as leaders, like you said, throughout the state and say, you know, this is what we did as a community. And we talked a little bit before the show too, that equity is not just, it's not just skin color. It's not just, it's sexuality, it's income. It's just so many different things on so many different levels.
Rural versus urban.
Right.
And so, you know, I think we have a tremendous opportunity between, with us being so close to Nashua, that we have a tremendous opportunity to lock arms and to work together and to come up with creative solutions so that our kids can come out of this healthy, balanced, and well again at the end of all of this. And I know that's the goal for everyone.
Yeah, it sounds just, it's, I'm actually just so thrilled to have learned about this because it is my town. It makes me very proud that they're taking on this work because it's not, as we discussed, not necessarily the most diverse town when you just, you know, take a snapshot of it. But the fact that they're paying attention to it and that we can help other communities, hopefully, in the future, just makes me really proud as well.
You know, that's the heart of what a Granite Stater is. It's taking our small town and being able to, you know, take issues head on and share what we learn with our folks next door, with our neighbors. That is the heart of what a Granite Stater means to me. I don't know any other word about it. And I think that, again, you know, this pandemic, although it has brought tremendous amount of grief and challenges, has birthed so much creativity and ingenuity and innovation. There's so much potential that is just waiting to be used, and I'm really looking forward to coming out on the other side and bringing people along in a way that maybe has not been done before.
And you know, I'm going to end on that silver lining, happy, positive note, because so often when we talk, you know, at the top of the hour, we have to deliver the grim statistics about COVID in our community. So thank you. Thank you so much for delivering that message to us as we enter this holiday season. And thank you for joining us. And I want to thank all of you for joining us. This will be our last show until the new year. So wishing you all a very happy and healthy holiday together, safely, wearing your masks, staying home, being with each other and your community. If you do need a COVID test, we do offer a COVID clinic every Tuesday from 3 to 5. Our clinic has now moved. We'll be at the National Guard Armory on 154 Daniel Webster Highway. You can make an appointment calling our hotline 589-3456, or you can go online to the division website and arrange for a test by filling out a form. Again, stay safe, stay warm, and happy holidays.